My next test that I'll be completing is Ober's test. The purpose of this test is to assess the tensor fascia lata, so the muscle that does flexion of the hip, and the iliotibial band for tightness. So the patient position is in side lying with the patient's lower leg flexed at the knee and the hip for stability. The upper leg is the test leg. The examiner stands behind the thigh that is being tested. One of the examiner's hands is placed beneath the patient's knee to lift the leg, and the other hand is placed on the pelvis to stabilize. The examiner passively abducts the patient's leg and extends the leg. This can be done with the patient's leg straight or flexed at the knee 90 degrees. The examiner slowly lowers the patient's leg after abducting and extending it. This test is important to extend after abducting because the iliotibial band needs to pass over the greater trochanter, needs to slide over. The examiner must also stabilize the pelvis while doing this procedure so that the patient does not fall back. If the patient falls back, then it's no good. The examiner watches to make sure that the patient does not side tilt, and then the leg is lowered. A positive sign for this test would be if the leg does not lower to the table after being abducted. That means that there's a contracture present in that muscle or the iliotibial band. With a normal IT band length, the leg should lower and the foot should be able to touch the table. If it can't, then that's positive.
For further information of the Ober's test, you can refer to page 331 of your Orthopedic Physical Assessment Atlas and Video Textbook. Page 331.